So, what are some signs and symptoms people can use to tell that they have nephrotic syndrome?
Yeah. So that's something we think about all the time. And as a nephrologist seeing patients in clinic, I often ask, what was the first thing that you noticed or what happened? And the major symptom that a patient will have is swelling. That's for the most part when someone has like really obvious nephrotic syndrome, they get swollen. They get swollen around their eyes. They get swelling in their legs. Little babies who are smaller may get swelling in their belly or their private parts. And oftentimes what happens is that they go to the doctor and the doctor diagnoses them with allergies because they get swollen around the eyes. But allergy medicines don't typically help. Some people with this condition don't necessarily have the massive swelling, and that's a little more challenging because it can be a quieter, unrecognized condition, but they might have some fatigue or lower energy. Some people also say that when they have their nephrotic syndrome, their urine gets foamier than usual. So those are the symptoms. So in medicine, the symptoms are what a patient reports, and then the signs are what we can tell on physical exam or lab tests. So once we see a patient who we worry about having nephrotic syndrome, we check a urine test to check if there's protein in the urine, and that's called proteinuria, and that we use a urinalysis or a dipstick. And then if the protein is in the urine, then it's not in the bloodstream. So we check the blood for their protein levels, and the major protein in the blood is albumin. So if you have protein in your urine, and then you have low albumin in your blood, and then you have swelling, those are 3 of the 4 cardinal features of nephrotic syndrome. And then the 4th one is high cholesterol or lipids in your blood.